All right, well, welcome everybody to the 8th meeting of the Medicaid Client Voice Council. I'm Jason Peterson, Deputy Chief of Community Engagement for the Department of Human Services. Welcome to everybody watching online, including several of our council members who notified me yesterday or today that due to family circumstances they could not be here today. If you are watching out there on Zoom and you're a council member and you have something you'd like to add to the conversation, you have my personal cell number, so text me your questions or your comments. I'll keep an eye on my phone and I can add those during the Q&A periods after each of our presentations. For those of you who are here, don't forget that you have your reimbursement forms in your folders. Be sure to sign those so that the folks here at AFMC can get your payments issued to you in a timely manner. Thank you for accommodating. They're doing some renovations in the annex right down here. We should be back in the annex for our next meeting in July. I've been told that they are hopeful to be completed down there in 5 or 6 weeks. We'll see. If not, we can meet again up here. This is where we met for the first year. For those of you who are new, this is the space we used for the first year of the Medicaid Client Voice Council. So for some, it's a return to something familiar. To others, it's your first time here. But we thank all of you for being here and for your service on the council. We have a pretty full agenda. We've got 4 topics we're going to cover today, including a Q&A period at the end, kind of an open session. But you're going to get an update on the public health emergency unwinding. We have submitted our first report to the federal government, one of 5 states to do so you can ask some questions about that, and you'll hear an update on how Arkansas is doing and some of the numbers. Amy Webb will share that. Medicaid renewal process, specifically relating to TEFRA, is one of our presentations this morning, as well as the public comment period is open right now for the Opportunities for Success initiative. So you as a council can be a part of that open comment period. And finally, we'll have some discussion about the changes that are coming to a self-direction program. One note, Secretary Putnam and Deputy Director Mann both had obligations. They are not here today, but as you can see, a lot of the rest of our DHS leadership is here today. And that is all I have to share. Our Council President, Jerry Watson, may have some opening comments before we get to our first item on the agenda.
Oh, I'm the council chairperson, but if you want to promote me to president, that's fine.
You just got a promotion. Your pay stays the same, though.
I'll accept that 6-figure salary for presidents receive. But anyway, good morning, everyone. First, giving honor to God, I'm Reverend Jerry Watson. Welcome to the Medicaid Client Voice Council bi-monthly meeting. And I'm glad to see those who were able to make it. It's a nice sunny day, like some of the past meetings would have been rainy. So God blessed us with a beautiful day. My comments initially have to do with the Work Opportunities program. I think it's a great opportunity for Arkansas. Arkansas is currently the poorest state per capita in the United States. And this is an opportunity to rise from the bottom. And one of my goals is to help that come about. And one of the things personally that I plan to do is to help teach people how to use artificial intelligence. So I believe that artificial intelligence is the quickest way to go from poverty to wealth. But anyway, if anyone has any questions, always feel free to contact me via email, and I can share information with you. Thank you and have a blessed day.
All right, thank you, Jerry. So the first topic, as usual at these meetings, it has been this way for several of our past meetings, is the public health emergency and the unwinding and how that's impacting Medicaid recipients or beneficiaries around the state. So Amy Webb is our Medicaid director at the Department of Human Services. She's going to give you an update with the numbers. There's no slide presentation for this presentation, because the numbers change daily. And but we will have slide presentations that hopefully you all received in your email and were able to review for some of our other presentations. So let me welcome Amy Webb to the podium.
Good morning, everybody. Let me see. Do I need to move this down?
This will work, but if you stray, you grab that.
Oh, because he knows I talk with my hands and I walk around. Okay. That was a very polite way to say that. So, okay, so what I thought I would do is walk through some of the numbers that we have from the unwinding and really then just open it up for questions. Because I thought y'all might have a lot of questions and I wanted to leave time for that. I have a doctor's appointment that I need to leave for by 12:10-ish. So I want to leave time for that. All right, so with that in mind, let me just give you a couple bits of information. So we have now initiated renewals for the unwinding for the 4th month. They went out last weekend for the May group. And that was our largest group. So any category can be in the renewal during February, March, April, June, because we're also doing regular renewals, we're doing household renewals. So it's it can capture a lot of different categories of assistance. But the main category of assistance for February, March, April, May were our home, our kids, and parent caretaker relative. And those will be reflected in the numbers. So I just want to give you a sense of that as we talk through the numbers. And then we will begin moving through the renewals for specialty populations in June. So those are, if they weren't caught up in other household or regular renewals, PASS, TEFRA, the DD waiver, autism waiver, those populations will come up starting in June. And then we will wrap up sending out unwinding renewals in July. Because remember, we have to initiate and complete them in 6 months by state law. So the last of those renewals will go out in July so that we'll be wrapped up by the end of September. So, okay, so numbers. So first, in the month of April, we terminated 72,802 Medicaid clients. And those could have been due in April, but not necessarily were all due in April. They could have been due in March or May and turned something in. But the reason why I differentiate that is because CMS, the federal government, wants us to focus more on and provide information specific to what was due in April and what was initiated in April. So I'll give you a breakdown of those numbers. So the renewals that were due in April, 137,679. And then of those, 61,236 retain their coverage. And most of those were done on an ex parte basis. So that was the system checking to make sure, to see if they had enough information to go ahead and renew without the client have to do anything else. And then, let's see, let's skip down to my numbers. Hold on. So, and then 55,488 were terminated for procedural reasons. So those are the ones where we see people who did not return the renewal packet or they did not return a request for more information that we sent. And because that's a large number, I wanted to talk a little bit about what we've done. And as always, if you guys have ideas that we haven't done, we'd love to hear them. We're still going through this process. So on the ones where they did not return their packet. So one of the things that we did was we switched, so the AFMC call center that was calling people who were, extended and up for renewal, we switched their work where they were calling people who had a packet due and they had not returned it. So we tried to do a focused effort to reach out to those individuals to get their renewals done. And we also asked them to do a specialty focus on individuals who we could see in the system had a cancer I can't remember if it was a cancer claim, like a treatment claim in the last 4 months, dialysis in the last 4 months, or a pregnancy diagnosis in the system. So we wanted to try to reach out to them by phone as well to try to help focus that effort since they had not returned their packet and we knew they were doing serious treatment. And then one other thing that we did was around the March 31st tornadoes. So in those 10 zip codes that were identified in the federal disaster declaration, we moved their closure dates out for anybody who had not returned their packet or not returned requested information. So we moved that out until June to give them more time, given the tornado situation. Let's see. And then a couple other things we've done related to those populations that haven't returned. We're still sending lists to the QHPs for our home clients, the passes, net and dental, to try to get them to focus. And we switched the list so that it is people, what they're getting on a weekly basis now is a list of people who, I'm having to go through and remember exactly how we worded it, but people who were due in this month or due in the next month, and they're getting a list of those who are closing, and then also with the reason code. So if they see that there's somebody closing because they didn't provide verification, then those passes and their care coordinators can reach out to them to try to help us, and that's what we're asking them to do. And then I think that is in general kind of the big things we've done to target those populations. And then one other thing I wanted to share, and I'll open it up for questions, and this is really hot off the presses. So we had some legislative inquiries about demographics related to this population. I thought you guys might be interested in that, and I literally just got it before we came here. So let me give you a breakdown by gender of the closures, that 72,000 number. The closures, 41,255 were female, 31,547 were male. And then a breakdown by race. So white, 41,532. Black or African American, 14,598. Asian Indian, 1,000. American Indian Alaskan Native, 605. Pacific Islander, 523. And then the rest are either two or more races or they did not report a race. And there was a large number, like 12,000, that did not report a race. And then our largest categories of terminations were our home, our kids A, our kids B, and parent caretaker. And I also have counties if you have questions about that. But, so with that, I'll stop throwing numbers at you and I'll just open it up for questions, and Mary's going to come up and answer questions as well.
Also, let me remind you that for the folks on Zoom, we have to have a microphone in front of us when we talk, if the people at home are going to hear the questions. Michelle, did you have your hand?
Yes. Do you happen to know, I heard, and I think I've experienced it and seen other people experiencing it, Social Security Medicaid. I've heard they're dealing with a backlog, and I've experienced it myself with processing income and things of that nature. How is that impacting the unwinding? Because like I said,
So you've heard Social Security has a backlog?
Yes, and I've experienced it because I've turned in things and they've not been processed as quickly as they usually are. And so I went and looked it up because I was like, I've turned these things in like 3 or 4 times. Like, why? What's going on?
To Social Security?
Yes, and
Okay.
so.
I don't think we've heard that. Have you heard
But
that?
I looked it up because I was like, why? Things used to be like that.
Yeah.
And I looked it up and they said that across the U.S., they're experiencing a backlog. And I have friends that have applied for Social Security for different things, that it's taking longer, like it went from 6 months to 9 months and things
Okay.
like that. And so I wasn't sure if that's going to impact some of the people that you're trying to get in touch with.
I mean, that
because-
may definitely, I'm sorry, I didn't mean to interrupt.
Oh, no, because I didn't know, because I know some people or some kids are on
Yes.
Social Security Medicaid, and so what happens when that finally gets processed, I guess I don't understand, like, if that gets processed, how is that different, the Social Security Medicaid from, the regular Medicaid? Will they get a renewal packet or whatever, or will Social Security, that's through Social Security whether or not they would continue Medicaid?
So we've spent a lot of time in the last 3 or 4 weeks looking at this population. So I can answer some questions, and Mary can answer some questions. But so let me start with the basics. So Social Security, when someone has Social Security, Social Security will send us a file and say, hey, these people should get Social Security Medicaid. They determine eligibility, so we do not determine eligibility for that category of assistance, which is kind of an outlier compared to everything else that we do. So that means, one, to your question, Michelle, no, they will not get a renewal packet from us, but we've got some caveats to that I'll explain in a second, or maybe Mary can explain that, I don't. So they do not generally get a renewal packet from us, because we don't determine their eligibility. So there's a couple things that we've done. We've kind of moved back some closures on some Social Security cases, so that we could double check things, make sure things were going correctly and that the system was handling them correctly, because these are very vulnerable populations. We want to make sure that it is done right. And so one of the things that we've done, we've seen that there are going to be legitimate Social Security closures. And the way that the system is set up, because we don't determine eligibility and we only get limited information from Social Security, we don't run Social Security Medicaid terminations through the system to see if they're eligible for other categories of assistance, because we don't have enough information to do that. So that is one of the things that we're looking at, is how do we change that, because we think that that will be helpful to change, and Mary can talk more about that. And then the other thing that we're looking at, I've lost my train of thought because I was rambling. So can you pick up from, in terms of the Social Security, the special approach that y'all took so that people could apply before they lose SSI Medicaid? Mm-hmm. Okay. Sorry, I got myself twisted and then I forgot what I was saying, so.
Hi, everybody. I'll backtrack just a little bit. I don't know if Social Security has a backlog. It's not something I've heard, but want to make sure everybody knows. If you have applied for Social Security, disability, or SSI, that does not prevent anyone from also applying for Medicaid through DHS. And if you qualify in any category that we offer, then we're going to go ahead and approve you. And then subsequently, if Social Security approves you for SSI, we'll make that change and switch over the category. So I wanted to put that out there so that people don't wait for Social Security thinking, well, I applied for Social Security, so I can't apply for Medicaid, because you can. And yes, what we have done to try and help individuals who we have gotten information from Social Security that their SSI should close. We, as Amy mentioned, we did extend that first group through June 15th. And we sent them a letter letting them know that, and that they could, appeal. And we also have set up a process where if people wait till the 25th, they can apply for Medicaid for us to look at all the different categories. And our system will look ahead past June 15th if they wait until May 25th. But if not, we have circulated a special paper application, which we marked at the top SSI, and we've set up a process internally where if you're working with any of the DHS programs and they want to go ahead and fill out a paper application, they can, and they can send it to us in DCO, and we'll know to handle it specially and go ahead and get that application ready to move through the system.
And that was the one thing I lost track of when I was talking was, so right now, if you lose your SSI Medicaid and you came to us to apply, well, the system would show you still had Medicaid, so it would deny that. So we set up a special system and a system change so that it would accept that and people could go ahead and apply. Because we do know, there are a lot of, I think what we've heard is kids will lose, there are kids who will lose SSI, but they would be eligible for our kids. So we want to make sure that that avenue is open so that they can access that without a loss in coverage. Sorry, thank you. I don't know why I got so tongue-tied on that. But.
Okay, did you have a question? Okay.
So a lot of people in our community, they drew the unemployment during the pandemic time, and So they were approved for insurance, and then they're sending out documents requesting additional information like pay stubs, et cetera, because I think they probably did the ex parte, like you said at the beginning, and then now they're checking for income. So several of the people have went to the unemployment office. They're not necessarily printing things off for individuals, and I don't understand how, with the unemployment office being a state or federal program, how that there's not communication between the programs as to, okay, so this said individual did not get unemployment as of April 1st of 2022 anymore.
So I mean, I can't speak to what workforce services will print or provide clients from their perspective. But we do have an interface between our system and their system, so there is a lot of information we can see. I can't tell you 100% for sure if we are seeing everything we need with the pandemic insurance being different from the normal insurance, but we do have an interface, and we would only be asking, or should only be asking, if it's for information we need that we can't get through that interface.
And so, Reba, are you saying that, like, people need, like, something specific and they can't get it from?
No, it's not only just DHS, like it's even the state of Arkansas, because I'm an accountant and I do taxes, and I might even have someone that comes through and a spouse doesn't even owe the debt and another spouse does. The unemployment office, they're not very receptive to printing stuff off. And I even went in just to try to get something printed off, and they just blatantly told me that you guys should have it in the system, because they'd had a lot of people going through just up in our county and Craighead County, because apparently they were asking for closures. Like, they were still saying that people were getting this unemployment and they were not. And then since they were no longer getting the unemployment, they had to prove that they weren't getting, and unemployment ended a long time ago. And so I just went in to see if I could get something printed off, just to see how difficult the process was. And it really is difficult. And they just blatantly told me, you know, we're all interface. They should have this information. We shouldn't have to be printing this off for everybody coming through here. That was their words.
Well, I am not sure what interfaces workforce services might have with other agencies that may determine eligibility for different things and need proof. But I do know that we have one at DHS, and if anyone has a concern that DHS is asking them for information that we should already have access to, then certainly please ask to speak to a supervisor or the county administrator, or email our Access Anywhere, or fill out our Access Anywhere web form online, and then we review and read every one of those and respond to them, so we could answer that question.
Curious that question.
Okay, according to the numbers that you gave, Amy, about 41% of those who went through the unwinding so far have been disenrolled. Am I correct, or am I off base, or what?
I have not done the math, Jerry, so I apologize. In terms of percentages, I have not done that, so.
Okay, if I'm correct, that means out of the 1.3 million that were last year that were on Medicaid, some form of Medicaid, that's over 500,000 people going to lose their services in the next 2 or 3 months.
So so we don't have a specific number that we are saying are going to lose coverage. Let me give you a couple things. So one, the first 4 months are going to be a lot different than the remaining months, because we're doing our largest buckets first. So our home, our kids, PCR, that is the vast majority of the extended individuals in those buckets. So that's our largest group. So the ones we send out June, July, August, or not August, June and July, those buckets are not as large. So we don't expect to see the same level of terminations that we have seen this month with those. And then I think that though we haven't put out a specific number, what they're saying nationally is 15 to 30% of Medicaid clients could lose coverage during the unwinding across the country.
Okay, I know it's relatively early in the process, but Arkansas is disenrolling people faster than any other state. So, and we do have the computer center, so you should be able to get better analytics than other states can get. So I'm curious how many of those people that are disenrolled qualify for other services. You know, if they're on Medicaid and they get disenrolled with Medicaid, but they qualify for AR Home or AR Kids or some other program.
So that is included in our numbers. So if they transitioned over, because for all other categories but SSI, we do look to see if there's another category that they may be eligible for. So that 72,000 number are, this is how the system people put it. They had coverage in April, they do not have coverage in May. So there are a lot of other people who maybe transitioned to another category of assistance or aged out of categories and maybe are eligible for Medicare. We also will send all of those who have exceeded income, we send their information to the federal marketplace. And as I understand it, they're supposed to be actually calling people and reaching out to them to try to get them enrolled as well.
About what percentage of people didn't reply at all and got disenrolled?
So we did share the number of what we would call procedural closures, which means that would be part of that group, 55,488. That could include failure to return the packet, failure to return any other information we might have asked for, things like that.
So
And why
55,000.
we may not have gotten it back, that's, could be for a lot of reasons.
That's 55,000 out of,
Out of the 100.
137,679.
so that's about 40%.
I'm a former journalist, so I don't do math on the fly. That's-
You don't do math on the fly.
Yeah.
But I will say, and just as a reminder for everybody, particularly people watching, if those people come back, they have, depending on the category they're in, 30 days or 90 days to come back, give us that information, and their coverage will just kick right back in. So without having to reapply. Yes, that's churned. Yeah.
Right, that is churn, and, but that is also a safeguard. If you didn't return your packet and you had Magi Medicaid, which is the Our Home, Our Kids, parent caretaker relative, pregnant women, newborn, then as long as we get the information within 90 days of your closure, we'll go back and take a look and determine the eligibility. If they're eligible, we'll reinstate them without a break in their Medicaid coverage dates. We do that for 30 days for all of our other categories that also involve not only financial but
Medical.
and resource limits and determinations we have to make. And, we can't speak to the reasons why people didn't return the forms. We do know that here in Arkansas, we had 2 increases in minimum wage during this pandemic. And we do know that a number of people will have selected themselves out of the program because they don't need it. They may have insurance through another avenue, through an employer. But we don't know, because if we didn't get the packet, we don't know why it wasn't returned.
Allison's got a question, and that's Heather and Frank.
Quick comment first. I just want to say thank you for everything that y'all are doing to get the word out to people. It was probably been a year ago that you first presented your plan of all the different ways that you plan to communicate it, and I've seen it as a client. Like, I've seen the posters in my doctor's offices. I've gotten the email from my school. So the communication that y'all have shared with the other people that have direct impact or connection with us, it's working. So keep it up. And please give kudos to your team, because I know it's been a Herculean effort.
Definitely, they will appreciate
Yes.
that.
And
Thank
y'all
you.
have added to what you shared a year ago, like that you're sending these detailed lists every year or every week, to the PASS. Must be Herculean. Anyway, my question is, I'm trying to follow this path down the road. So somebody loses coverage and there's all these reasons, right? One may be that I moved and I haven't gotten anything from y'all because I moved and I didn't change my address like I should have and whatever. But I'm going to find out I don't have coverage when I get to the doctor or when I get my child to the doctor. is there anything that you have given or could provide to doctors' offices to make sure that they don't just say, sorry, you don't have Medicaid anymore, I just ran it and you're no longer? Is there anything that those folks could have to kind of guide people back into the process? I mean, hopefully they would come within their appeal window, but chances are a lot of folks are going to have to start over.
Start. I mean, we are sending PCPs lists. And I mean, what we're asking, we're not just asking them to like talk to, like we're asking them to take action. Like talk to your clients, actually send them emails, send them texts, however you normally communicate with them, do that.
I'm just working on the assumption of like, that fails because there is no phone number, there is no address, right?
Yeah. I don't know what the process is normally.
Well, we are available through multiple avenues. People can go online to reapply. They can go to a county office. They can do a paper applications. There's multiple ways that people can get, back in touch with us and do the paperwork they need to do so that we can redetermine eligibility. Or if they wait long, if they don't know they're closed and they don't have to go to the doctor for 6 months and we're past that window, then they can certainly reapply at any time.
And I do know that Gavin's team has just switched over to, I don't know if it has a name, but a campaign where it's like, if you've lost coverage, here's what you need to do. And we put something online with every scenario that we could think of, and then how people should respond to those scenarios. So we're trying to get that information out, because I think that is inevitable, that people will lose coverage, either not know or not worry about it, and then when they need it, then they're going to start worrying about it again.
I just wanted to kind of piggyback and try to answer your question, because I was one of the ones that was got terminated and didn't realize that I was terminated. Number one, I didn't realize we had always at first been a part of Our Kids, and so when we moved to PASS, I've always thought that we were still using Our Kids. Well, I didn't know that we had switched. They switched us to Social Security. Had no clue. So how I found out was that my PASS, which we love them so, they called us and told us that, hey, you were on our list, and you no longer have coverage. And of course, I freaked out. I was like, wait a minute, I'm on the council. I'm supposed to be waiting on the packet. Didn't get it. And also, my son also received home care aid. They called as well. So it just started being a trickle effect and trying to get it back up. And our reasoning for not having it was because of my son was in behavioral health center. And so when he moved home, they shut him off because he was no longer living there. So when he was receiving his Social Security, when you sign up to be in the behavioral health place, you have to give over your Social Security to the behavioral health center. And so they were considered his payee. The person that was receiving the money, they considered that as to where he was living. And so when he came home, I had no clue that they were still considered like his payee or that. So I had to go back. I think he was cut off in January, and I didn't get the message to maybe March. That's like, hey, he no longer has the services and stuff. So, and it was a journey with trying to get through Social Security, trying to get him back, and maybe 6 people to finally get to know why he was number one terminated. And it was just something as simple as the pay change, but it wasn't as simple as we thought it would be. But so there are people who will contact you to let you know that, some of the services that you will receive, they have, like I said, with our PASS coordinators, they called immediately. It's like, hey, we're on the list, and I'm not sure why. So let's check. And it took about a month to get it all figured out, but we did get it figured out.
Well, I'm glad that you're getting those calls. I mean, that's what we had hoped, and the fact that it worked, that makes me really happy.
Thank you for sharing that. It's good for us to hear the things that all these teams are working so hard on, are making a difference. So thank
And
you.
I will say, we've heard a couple other people who have had that same payee issue. And it took some digging to kind of figure all that out, so.
Allison beat me to it, but I agree. This is a huge task, and we appreciate you guys working through this. I know that there's a lot of places that things could break down, and y'all have anticipated a lot of those, and we appreciate that. My question is about the number of people who've been taken off. We were denied because we didn't turn our paperwork in on time, but we did. It was due on the 10th, and on the 11th, I got a letter in the mail saying that we had not turned our paperwork in. When I called the number on the form, they said, "Oh, your paperwork is here. We're not sure why you got that." And then we got denied a second time for an income reason that also wasn't a real reason. But my question is, when we got reinstated, do we come off of that 72,000 number, or does that number, my question is, as we go through this process, is that a floating number that may change?
If we reopen your case, then you would not be on the PHE extended list. But if we've done a report where they've asked what was the status, what were the numbers as of this particular date, that report won't change. But yes,
It will be reflected in
enrollment.
numbers. So we are looking at that too, kind of like where we were and where we were when we started unwinding, which was significantly higher than we had ever been. So we're watching those too. So that number will definitely change every day, all the time, so.
It sounds
Yes.
like a big, scary number right now, but as we go through the process, it sounds like it's going to kind of get massaged out.
Yeah, and we do expect, I mean, there's churn just normally in Medicaid. I mean, I know it's not like the best thing, I wish we could figure out a way to solve it, but it has existed for the history of Medicaid. So I think that is going to continue, and we're going to see that number ebb and flow.
I want to see if I understood you right a while ago. I'm on SSI right now, and I'm receiving Medicaid. But my dad's recently retired in January, and they told me I'm going to have to get off SSI and move over to Social Security Disability under my dad's name. Will I have to do anything to keep my Medicaid, or will y'all automatically move me over?
So I think that if you have been determined eligible simultaneously for SSI and one of the waivers, that the SSI ending would not necessarily impact the waiver continuing, but thinking through those things are part of why we went ahead and extended the closures for SSI, so that we can look at those things and make sure people have the opportunity to appeal, for one thing, and or work to get whatever the issues are with Social Security resolved, and also to give us information so that we could determine additional eligibility beyond SSI. But
Bradley, I'd be
Yeah.
curious, like what letters have y'all gotten from us yet about this? Nothing yet?
okay,
The only reason I was asking is this is all new, because they said I couldn't stay on SSI now.
well, and if you aren't eligible for SSI payment anymore, that does not mean that you would not be eligible for Medicaid, because we have, SSI is only one of the Medicaid categories. There are many Medicaid categories.
Yeah, that's what I didn't know, if I would have to contact you, or if y'all would take care of transferring me over.
Well, when you get any letters, I would just say reach out to us, and we will make sure what you need to do next. We'll help you through that process.
All right, our next topic is related to the Medicaid unwinding, specifically more to TEFRA. So Betty, did you have a question?
Respond to what you said. A similar situation, my son was on SSI, and when my husband retired, he moved over to Social Security. But Social Security advised us to maintain a small amount of SSI, like $15 a month, and so he still has SSI and Social Security Medicaid. So I don't know if that's an answer, but that's what they advised us to do, and that has been working, so.
Okay, one more question on this topic before we change, and that's going to be from Frank.
Okay, so you mentioned how the special populations like the DDS waiver and past populations, they're going to go through the renewal process in June. And then you also mentioned that the the tornado zip codes, they're getting some kind of extension. What will happen to the special population people that were in those tornado zip codes?
So if they've already got, oh, sorry. If those tornado victims have already gotten their renewal, so it just depends on when they got the renewal, Frank. So like most of the specialty populations will go in June, but there are some reasons where some people in a specialty, and that's my term, I'm just using it to describe like all of those waivers, but some of those people got renewals earlier. And if they got a renewal earlier, then they'll be extended to June. But it is in line with the renewal that you got. So whatever notice they got, it's, you know, if you already got it, then you're part of that group. And if you haven't gotten it, then you'll just go through the process and be in line with whatever your notice said. Did that make sense? I don't know if that made sense. That was a, look, Melissa's like, no, that did not make sense.
Melissa wants to come up and try it.
Well, I would just say, if you get any information from us, it's very important that you respond to it. We're always going to say we need this back by a particular date. So it's very important that you check your mail and respond to it. And if you need more time to get us what we've asked for, then reach out to DHS, to a county office or our toll-free number and say, I need more time, so that we can give you that extension.
And the only tornado victims that were extended to June were ones who had already received their renewal, if that makes sense. So if they hadn't received their renewal yet, then they have not been extended. Maybe something that we need to talk about, but it also has to fit within the 6-month window too, so.
All right, thank you to Amy. Amy has to leave. She mentioned that off the top. Grab a lunch on your way out if they're out there, Amy. And Mary's going to stay up here. Mary Franklin, I think you introduced yourself as Director of County Operations, but if you didn't, that's your responsibilities.
Jason.
You're welcome. But the Medicaid renewal process, specifically as it relates to TEFRA, is something that Mary wants to discuss with you and entertain your questions about. So, Mary?
Okay. And is this the arrow?
Yes,
keys?
yes.
Okay. So good morning, everybody. I'm actually starting with just a general overview of TEFRA, and then we can talk about any questions related to renewal. Oh, okay. All right, so TEFRA, it's an acronym. We love our acronyms at the Department of Human Services. Tax Equity and Fiscal Responsibility Act is where the TEFRA program came from. And it provides Medicaid coverage to children under the age of 19 who have a disability and receive care in their homes rather than in an institution. It provides full range of Medicaid benefits, and families pay a premium for TEFRA on a sliding scale depending on the parent and guardian's income. So approval for TEFRA is based on 3 things. There are financial eligibility criteria, disability is a criteria, and medical necessity and appropriateness of care are criteria for eligibility for TEFRA. So for disability requirement, a child must meet the Social Security definition of disability for a child. And if a child applies for Medicaid and they have received SSI in the last year, and that SSI closed, but it closed for a reason that wasn't related to disability, we see frequently SSI might close because of parents' income change. The parents of the child's income increased and the child's no longer eligible for SSI. And we also see kids where in some months where parents might get 5 paychecks instead of 4 paychecks, where they might lose SSI for just, temporarily because of that. But if the child's had SSI in the last year and disability wasn't the reason the SSI closed, then we use that SSI disability determination for a year from the closure. But we also get applications from children who've not applied for SSI. And so the way we determine disability for a child who has not had SSI is we have, or for a child whose SSI has been closed for more than 12 months, we have an internal team at DHS. It's called the Medical Review Team. They review medical records. We will ask parents, please complete this paperwork. Please give us consent to contact your child's medical providers so that we can gather all that information. And that team uses the same criteria that Social Security uses to determine disability. As I mentioned, the medical review team will review paperwork, medical records from the child's health care providers to make that decision. And they'll also determine whether that disability should be considered permanent or not necessarily permanent, and it might need to be reviewed periodically. So, medical necessity, that eligibility requirement, the child has to have a medical condition that would require institutional placement or be at risk of institutional placement if they did not receive these services. It's also based on services that improve or maintain a child's health or prevent a child from getting worse. Also, continuing to talk a little more about medical necessity and appropriateness of care. After this child is determined disabled, either by Social Security or by the DHS Medical Review Team, then in the Division of Provider Services and Quality Assurance, an RN determines appropriateness for what appropriate medical services need to be provided and if those would be available to the child in the home. And the estimated cost of any care the child needs in the home can't exceed the cost of a child if they were in an institution. Financial requirements are some of they're the most simple part of a TEFRA eligibility determination. The parent and guardian income and resources don't count in TEFRA. We only look at the income or resources that the child has. And the income limit for TEFRA, for that child's income, can't exceed, at this point, it's $2,742, which is 3 times the SSI payment amount. And so it changes when the SSI payment amount changes. But right now, that's $2,742 a month. And the child's countable resources can't exceed $2,000. I mentioned earlier that there are premiums for the TEFRA program, and that premium amount is based on the parent or guardian's income. There are no premiums charged for families under 150% of the federal poverty level or those with incomes under $25,000 annually. And for TEFRA, children do not pay co-pays for services, and families cannot pay more than 5% of their household income when premiums are being determined. And this is just a look at the premium amounts. You can see 0, no premium for $25,000 and under annual income. If the income is $25,001 to $50,000, it's 1%, and $20 from $20 to $41 a month. Renewals for TEFRA. We are required to renew cases every 12 months. And to ensure that we get those renewals completed by that 12th month, we start in the 9th month, which is about 120 days ahead of time. And then we can grant extensions to return information if we ask for information during that process and you need more time. We just need to know so that we can extend that due date. And also at renewal, we look at all eligibility factors, including the appropriateness of care. All of that will be redetermined. If the disability was determined by DHS and determined it needed to be reviewed, then we will also do a renewal of that. We will ask for medical records that you all indicate that are the child's medical providers, and we'll redetermine disability. And we look at the premium amount again at renewal annually to see if the income has changed and then reset that premium amount based on the income of the parents. And this is a special note that I wanted to make sure I talked about related to the public health emergency and the end of the public health emergency. Beneficiaries were not required to pay premiums during the PHE. We charged premiums. We did not close cases if the premiums were not paid or they were behind. But now that the PHE has ended, those premiums are going to be billed, and then negative actions can happen if those premiums go unpaid for 90 days. So beginning June 1st, beneficiaries will begin paying TEFRA premiums again. And from that date going forward, if they haven't been paid for 3 months, then the case would close. So if someone did not pay their premiums during the PHE between March 1st of 2020 and May 31st of 23, DHS is not going to recoup those premiums or continue trying to collect those premiums from the parents. And if going forward TEFRA coverage is lost due to premium non-payment, a new application does have to be submitted, and the past premiums that were missed do have to be paid. If the family reapplies within 12 months of that closure. This is just also a look at by household size premiums. For example, if 150% of FPL and below don't pay premiums. So you can see a family of 4, if that family of 4 makes $45,000 or less, that family would not have a premium. So this is just to give you an idea of what 150% of FPL is based on family size. And our contact information, of course, we have toll-free numbers. Client assistance is 800-482-8988. We have our toll-free number here for Medicaid questions that AFMC actually helps us answer those calls at 855-372-1084. And the 800-482-5431 is specifically about Medicaid claims questions. But if you call any of the numbers, we'll get you to the right place. And then specifically for TEFRA billing or invoice questions, you would need to call the TEFRA premium unit, and that number is at the bottom here, 866-239-9938. And of course, we also have, this is our, we have information here on TEFRA. More information, more phone numbers about TEFRA on our website. And as always, you can get information, apply for services, create an account at our Access Arkansas website. And I want to share one more thing with you, which is not specifically related to TEFRA, but it's something we've talked about for several months. And I told you we were looking for a solution, and this is related to the remote identity proofing on our Access Arkansas website, where to verify that the person who's creating the account really is that person, there is we use Experian to verify that identity, and sometimes people can't get through those questions because maybe this is a person who hasn't rented a home or had a credit card or any bank account, any of those things that that those services would use to help verify identity. So in August, we have tentatively scheduled for an August enhancement that will give people who cannot do that through Experian, through Access Arkansas online, the ability to call us at DHS, verify identity so that we can actually help link your cases. So it's not today, but it's coming in the near future, and I wanted to share that with you, and I'll be happy to answer any questions about TEFRA or other things.
I know that's something Bradley's consistently asked about, so thank you for addressing that. Any questions? Michelle, we'll start with Michelle. If you have questions about TEFRA and the Medicaid renewal process, just put your hand up and I'll be watching for you.
I was just going to say, one, thank you for everything that y'all are doing and for the council coming up with a lot of ideas and, finding ways to address those things. And so my question is about TEFRA. I'm in the process of, trying to get applying for that. And so I uploaded a bunch of documents trying to be ahead of the game. And I noticed when I went through the process online to apply for TEFRA, it did not give me anywhere to put, like to type in doctors or put fax numbers, or there wasn't a paper that popped up and said, can you sign this so we can get medical records? Now, I mean, I've been checking it weekly because, I don't want, and I've figured what I'm probably going to end up having to do is maybe have to call and see if they're going to send me some kind of packet of things I need to fill out. But it did say they received it. They got, the documents I uploaded, but I haven't heard anything since then. Usually I'll get like a letter in the mail that says we received these things, and I haven't gotten that, which is kind of strange. And then, like I said, there was no document, no way to turn in a document to say, you have permission, because for TEFRA, because you have to
Right.
look at all the medical records, there was nothing on there. Is that supposed to be on there, or how are we supposed to access that to give people permission to
It's
the
a
records?
good question. That's a good question. I'm gonna have to check on that. I know that when, once you apply, someone on our team is gonna look at that application and see what we need, and you would get a notice. And you're right, that would include that paperwork specifically that we asked the doctor to fill out for TEFRA, plus any consent forms that we might need. I know once we do that, you would be able to upload those things. You should be able to upload them now, but I know it's a long list of things that,
It doesn't
pick up.
even give you the option.
It
I think
didn't?
it would be great if it could
Okay.
pop up something, either that you type in and do electronic signature, or if it could pop up and say print and scan back this, but it didn't give me any option
Okay,
to find any of that. And maybe I was overlooking it, but just from my view of doing it, I couldn't find that paper, and it would be so much easier if it was accessible online. And that way I don't have to call DHS or wait for a paper to come in, if it was just all right there and I could just do it and upload it. And that way it would be done, and I wouldn't have to wait for it. Because like I said, I'm probably gonna end up having to call and see how to fill that out, or where it needs to come from, to get it
Yes, ma'am.
back to somebody.
thank you for that feedback. It's good feedback. And what I'd like to do is get with you privately and get some additional information, because if we can look at your specific case, it'll help us see what it's doing versus is that what's expected, or what should it have been more? And I can follow back up with you. But thank you for that feedback.
Dondra has a question.
Yes, Ms. Mayor, my question is in regards to the TEFRA premium payments. Right now, the only way that I know is to pay the TEFRA premium is just through mail or the automatic withdrawal. Is there any way that maybe payments online can be added to that? I think it'll be a little bit better, especially if you have a past due payment, because when my daughter first got TEFRA, we were already 2 or 3 months behind on the TEFRA payment because I didn't get the paperwork in time. So we were already 2 or 3 months in, and I got payments sent back to me from the TEFRA premium unit because they were like, oh, you have to send the exact amount plus what's next month, and it was confusing. So I got
Okay.
like 2 or 3 payments sent back to me because it wasn't the correct payment that they wanted.
Hey, I'm Elizabeth, and TEFRA Premium Unit lives with my finance people, so I'll step up and try to take that one a little bit if you want me to. So yes, that right now those are the only ways. We are looking at whether or not we could accept credit card payments. There is a rule with the state and credit cards, that we can't pay the fee associated with the credit card company. They always charge that 5% fee on top of everything. The state can't pay that. So that would add to your premium, that whatever percent fee. It's a couple of dollars usually. So that's one of the caveats that we're kind of looking at. But that is something we're exploring. We filed a renewal with CMS last year. They put us on an extension and kind of have held off approving that because they're behind as well as all the states. But that is with that renewal. So hopefully more to come on that.
Thank you.
Tandra mentioned online payments. Has that been looked at?
Yeah, the credit card would allow you to go online and put in a credit card number and make that payment.
All right, Nathan had a question over here, and if anybody else does, just give me a little hand up and I'll look for you.
My question was in regards to the verification process. When this was initially brought up, I had mentioned various solutions as far as, an OTP via text or email. And while I understand the implementation is probably difficult, or even more so with a third-party verification system like login.gov, you had mentioned the verification process that you guys were looking at as opposed to Experian was a phone call. Did I understand that correct? Mm-hmm. Can you just kind of briefly explain what that would look like?
So I can't give you full details because what that exactly is going to look like is to be built for the August release. So I don't have all the details, but I did write your OTP via text down so I can take that back to the team. But at the minimum, there will be a way for you to call or someone to call DHS, verify who they are to DHS, and then have a worker on our side link your cases for you
And
so that you could use the online portal.
And is that going to be with an automated system or an actual human at DHS?
I believe that's going to be with the human at DHS. But when this gets, I can share more about the specifics on it closer to August.
Certainly.
Okay?
Certainly.
So remember to ask at our July
Yes.
meeting for an update.
Yes.
All right. Any other questions about Medicaid renewal, TEFRA, related questions for Mary before we break for lunch? All right, hearing none, we're going to adjourn for a half an hour, break for lunch, and we will resume the program after that.
Thank you, everybody.
All right, welcome back, everybody, from your break. Let me remind some of our council members who couldn't be here today who are watching on Zoom, in case you missed this at the top of the meeting. Council members have my personal cell phone, and if something comes up during the meeting that you have a comment on or have a suggestion about or a question, text me at my work number, and I will include that when we get to the Q&A parts of the discussion. So we're going to start our after lunch break agenda off with a talk about the Opportunities for Success initiative. You guys learned a little bit about that at our last meeting. We're in the public comment period right now for this. It's been submitted to CMS for review. It's in the public comment period through the 23rd of this month, so another week left for the public to make comments on the Opportunities for Success initiative. So you got a PowerPoint in your email. Hopefully you had a chance to review that. If not, we're about to go over it again. So let me welcome Division of Medical Services Director Elizabeth Pittman and DMS Assistant Director Nell Smith. They're going to discuss the Our Home Waiver Amendment, currently in the public comment period, I guess before it's submitted to CMS
Yes.
for
Correct.
consideration. This works, or you can hold that if you want to walk around.
Yeah, I'll walk around and try to make this work. I'm not usually the best at this. So to clarify, I think he clarified it there at the end. We have not submitted to CMS yet. We have to go through a state comment period of 30 days. We submit to CMS. Our goal is June 1st, and then we'll go through another 30-day public comment period with CMS. So you'll have that opportunity to comment as well. So. All right, so this is the Opportunities for Success initiative. It is not a work requirement. You may have heard that term. That is not what we are talking about today. We took a lot of things that we had done the first time when we did the work requirement and said, we don't want to do that again. That didn't work very well. How can we make this better and still help people to create sustainable opportunities for success as they receive our home services? So this tells you that time frame that I just went through. We're submitting to CMS on June 1st with the goal of starting implementation by January 1st. And the idea is to support engagement in work, education, and volunteering for our home enrollees who receive care through a qualified health plan. And as you may recall, we've talked about this a little bit before, some our home enrollees do not go into a QHP automatically. They are determined to be medically frail. They have some need for assistance that requires activities of daily living need. They need intense behavioral health services. They have some functional deficit. So their needs are such that the QHPs don't really provide the type of care that they need. And so they actually come over to fee-for-service Medicaid and they receive their services through us. That group does not apply to them. So this is only to those adults 19 through 64 who are in a QHP. So like I said, we took lessons learned from the first work requirement, and this is not one. So I try not to use that term when I'm talking about the Opportunities for Success initiative. We really wanted to focus on connections. Before it was all about reporting. Report us your hours. That's not what we're doing here. We want to focus on connecting individuals who are not employed or are underemployed with opportunities for work and for training in their community. We also want to connect them to health-related social needs. So if you have a need for housing or food, then we want to connect you there before we talk about getting you a job, because you're not going to be successful in work training or career development if you aren't eating or if you don't have a place to stay. So the idea is to create sustainability in people's lives by connecting them to the things they need to be successful. That includes housing, that includes food, that includes medical care, substance abuse treatment, and that also includes work and education training. There's no reporting requirement here. We will do data matches. I think Mary mentioned a little bit earlier that we do currently do data matches with the Department of Workforce Services, I believe. We're also looking at how to data match with Department of Education, a bunch of other state agencies. Nell is much more versed in that. So if you want those details, email us or ask us and we can give them to you. But we will match against all of these different state databases to see if you're already doing something that we consider on track, meaning you're already working, you're already going to school, you are receiving unemployment. There's a whole list of things. And if we data match you and it says, yes, this person is on track, then you don't have to do anything else. You automatically continue your coverage. If not, then we'll go on to what happens. So, and beneficiaries do not lose coverage. That's the big kicker here. We're not taking anyone off of Medicaid. If you do not participate in the Opportunities for Success initiative, you lose your QHP coverage and you go into fee-for-service Medicaid. And that's at 12 months for people that are considered unemployed, meaning they're below 20% of poverty. That's at 24 months for those considered underemployed. So they're from 20 to 80%, and that's at 36 months for those considered employed, which is at 80% to 138. So unemployed, like I said, that's those under 20% FPL. So there's no reporting requirement. We're going to look at what your current income is and determine which of these buckets you go into. That means you are currently at 20% FPL or lower, so we have determined that means you're not working, at least by what we can tell, what we can verify. Then we data match that and say, oh, you're not involved in any of these other things that we can see. You're not doing a school or work training program or serving as a caregiver or receiving treatment for a serious illness, something that we can data match against. And we check that at a certain time period. And if we're not able to data match and say, yes, you're on track, we assign you to a success coach. And a success coach is someone that we are going to hire either through a contract or through direct employment to work directly with the beneficiary. They'll contact them and ask that person if we really did miss something. Maybe you're providing caretaking services for your parent. That's not something we can data match for. Maybe you're volunteering every week at your local animal shelter because you want to work in that field. Again, not something we can data match for. So those are things that your success coach can ask you, verify, send us, and again, that says you're on track. We mark that down and we move on. If you're not on track, the success coach works with you to create an action plan. That action plan, like I said, first addresses anything you need, like housing, food, treatment for a medical condition, treatment for drug abuse or a mental health illness. Any of those things, addresses those first. And then it works on a career plan. What kind of job do you want? How do we get you into that field? What are some opportunities? Is there some training you need? What are some training programs? And so all of that would be put in your action plan. We verify if you're working on that action plan in 3 months with that success coach. And if we can verify that you've done something on that action plan, you stay in the QHP. That means you're working towards the success goals and you'll keep your QHP coverage. If not, then we put you in fee-for-service Medicaid, with the idea being that you're not really taking advantage of the benefits being offered through the QHP. And your coverage can be delivered through Medicaid, and you will still get the services you need, And when you're ready to engage in that Opportunities for Success initiative, you can come back and engage in the program. Receive that care through the QHP, which would include that ability to transition into the marketplace if your income goes above 138%. So the underemployed are those that are 21 to 80% of federal poverty. And I think Mary showed you kind of the 50%. That's kind of the scale here. The underemployed will not have to do any of the success coaching for 24 months. So just keep that in mind. So it's 12, 24, and 36. So they would remain in our home for 2 years before they were at risk of losing coverage. And to try to get them to a place where they were receiving more or making more money than 21 to 80% of federal poverty, or working towards a career goal, we would send them opportunities through monthly communications. We would direct them to our websites or other resource opportunities, and then at that time point of 24 months, we would reach out to them and offer them a success coach and go through that same process I just described. For employed, that's between 81 and 138%, and 138% is the top income level for our home. So if you're above that, you're in the federal exchange. We're going to focus on moving those beneficiaries to above 138%. You're considered employed at that point. You are working enough or bringing in enough income to work 30 hours per week at minimum wage at least. That's about 80% FPL. So we are going to focus on how do we move you into the marketplace. And if you'll recall, the marketplace here in Arkansas is the same plans that we offer through our home. So you can transition over to exactly the same insurance plan you already have with Medicaid. We pay for the same plans that you get on that marketplace. And the federal government offers subsidies, I believe, up to 400% of FPL. So you would receive a federal subsidy up to 400% of the federal poverty level. So you would continue to get assistance in that coverage. And so that's why we see this as sort of a way to, we all talk about the benefit cliff. We see this program and the ability to transition you over into that marketplace as a way to avoid that benefit cliff of you just no longer get any assistance, because you would transfer over to a program where you still received some assistance. So if you're in this employed category, you do continue to receive those outreach communications for 36 months, so that's 3 years. We kind of consider you to be on track, so we're giving you 3 years. A lot of people that come into our home initially do stay on for a fairly short amount of time. They need it to get through some particular point in their life. Some school, maybe they're going to school, doing some training, and so they're there just for that time, and they come off on their own without any assistance from us. We don't want to get in their way. They're doing great, so go for it. But if you are still on in 3 years and you would like some assistance getting off, we offer the Success Coach, and you can take advantage of it at that time. So that's the big piece of it. The other piece that we are doing as part of this Opportunities for Success is the Success Life 360 Home that I think we've presented to you. We are expanding that. And so that is an intensive care coordination program where a hospital partners with a community organization like a Goodwill or a Red Cross or an Our House, and they help young adults, currently young adults with health-related social needs. So right now the age ranges up to 30, depending on the category you're in. You can see that there. It's for those that were formerly in foster care, those that were incarcerated, formerly incarcerated, or in the juvenile justice system, or vets. And right now it is only for up to age 30. We are expanding that. It will still be those same 4 categories because we consider those to be categories that are at high risk of continued need for social services and at high risk in general for continued need of these particular systems that you see on here. There's a lot of recidivism or people going back into jail once they've gone to jail. So what can we do to help them be successful? So we're expanding that range to 59 to get the entire success population. And if they're in those 4 categories, we feel like they need a higher or more intensive level of care coordination and work than others. And so they would get that through this program. They would not have to do meet a success coach. Being involved in a Life 360 home is actually an exception. So if you're involved in one of these programs, then you are considered to be on track and you don't have to do the Opportunities for Success coaching. You get it through this. So we're expanding who can receive this, and we're really excited about that.
and that's a very short presentation. You can get the public notice documents. You can see the whole waiver on our website, and you can make public comments to us by May 23rd. So please submit those in writing, or you can call and talk to us if you have any questions. And happy to answer any today.
And again, you should all have the waivers in your email or a link to that site so you can review it if you just check your AFMC email. So questions, I saw a hand go up here. Let's start here and then hand it to Jerry.
Hey, thank you for that. I get most of this, but I'm going to pick on the parts that I don't quite understand. So the beginning, the opportunities for success, like I did read the entire announcement, the abbreviated version and the full one, so I could better understand it before today. So I really like something that came out there that I didn't see come out here. You did talk about it, but there was a table in there that basically shows how you guys are being really strategic about giving the people who need the most help, and really investing the resources in the people that are really just down here and not making forward movement toward education or work. I get it. I like the success coach idea. All of that I think is great. The part I don't understand is the QHP versus fee for service. So when you have someone who's down here and the coach works with them and they just don't make progress for any number of reasons, can't do, won't do, could be any of the above, and then you say, well, we've done all we can for you. Now we're going to move you to fee for service. What does that mean for that individual in terms of their health care?
So first off, fee for service with the plan we offer to the members, alternative to the QHP. So if you're medically frail, you already go into an alternative. One of those alternatives is identical to the QHP coverage. It offers the same services, right? So the same categories of services are offered. That's what these people will go to. So you won't lose coverage. You'll still get all of your services. What we won't do is buy that premium for you on the exchange, right? So right now I go to the marketplace and I say, Allison needs insurance. I'm going to buy Allison. She wants Blue Cross, so I'm going to buy Allison a Blue Cross plan. Allison costs $300 a month. I'm making all of this up. I have no idea. But we're going to pay $300 every month to keep Allison in her Blue Cross plan because Allison is going to use all of the incentives that they're offering, right? She's going to go to her preventative health services visit that they pay for. She's going to take advantage of the wellness opportunities and the exercise program and get her free Fitbit this year or her free herb garden or whatever it is that they're offering this year. You know, she's going to do all of that. If Allison isn't going to do all of that, I'm still paying $300 a month. And so those that are just really not engaging with us at all are not engaged, including in their health care. So they're not engaged in those preventative services programs. They're not using it for any sort of treatment. Then we're not going to pay that $300 a month until they're ready to do that.
Thank you. You've answered both my questions. The follow-up was going to be, if there's no change for the beneficiary, then what's in it for DHS? So thank you.
You're welcome.
Ahead, and I appreciate it.
First, I want to thank you for this program. I think it provides an opportunity for a lot of people to get out of poverty. My question is, how long do people have in the transition with their success coach? If you join the program and in 2 weeks you get a job, you're making an income that moves you out of your category, how soon do they take you out and move you to a new category?
So let me see if I can go back. I think the first slide is probably the best one. So if you look at this last bullet, so when you meet with your success coach, we wait. We data match you when you enroll. We data match you 6 months later. We assign you a success coach. Or none. Yeah. So if you get 3 months with that success coach before you have to make, at that very last bullet point there, you get 3 months with that success coach to show us you're doing something. It doesn't mean you move up to a completely new FPL. You may not get a job at all, but maybe your success coach said, you need to go to the food bank across the street, sign up for the food. Let's get you some food and make sure you're eating. Then let's get you enrolled in, you want to be a welder, so let's get you enrolled in a welding program and get you trained. Maybe that's what you do your first 3 months, is you go get food at the food bank and you go sign up for that welding program. That's great. You've done it. You've done what you need to do. We're going to continue to give you that success coach and continue to give you an opportunity to work with them. So there's not an end date as long as you're moving forward on that plan. It's when you're not moving forward on that plan that 3 months kicks in. And
Well, I'm
then,
talking about in terms of income level. When your income level changes, how soon before they transition you to another?
so we don't transition you off of our home until you hit 138% of federal poverty, and you either self-report that to us or we data match and find it out. And at that point, we would transition you. We send, I think Amy talked about that earlier, we send that information over to the federal exchange so that they have it and can contact you about getting a federal exchange program, and then we would transition you out. And that's a DCO function. I don't know if it's 30 days later you would get the notice and the chance to appeal, but I'm not exactly sure of that time frame.
Okay.
So that's how that would work.
One of the areas where people now have access throughout Arkansas to training is through the local libraries. It's called LinkedIn Learning, where you could, in a matter of minutes, you can develop expertise in a certain area. And just as an example, you can become a programmer and go out and get a job making $60,000 a year.
I want to know more about that. So if you could send that to Jason so he can get it to us. We're trying to compile some resources for the success coaches to use. So I think that would be useful for us.
Yeah, so, and it's free.
I love free.
I mean, or you could go on LinkedIn and purchase it for about $900 a year.
No, I stopped paying LinkedIn. I didn't get much out of it.
But going through the local library system, you can get access it for free, the training for free. You can gain knowledge a lot quicker in a shorter period of time and actually have certification that you have that knowledge and quickly get employed in a certain area faster than you can by going to college, getting a college degree or certification or something like that, which usually takes at least 6 months.
Can you send me a link to that?
Okay, I will.
Yeah, do that so we can make sure we add it to our resources.
Okay, so.
So I'm Nell Smith. We are also working, the governor's office is developing a workforce portal that there's existing right now something called Ready for Life, and I think maybe the LinkedIn Learning might be connected to Ready for Life, but there's a whole effort right now to really make a robust portal for the state to connect people to education, people to training, people to jobs, employers to employees. And so what we're hoping to do is connect this opportunity, this initiative, to that whole system. So
that's actually why she was late. She was there. Do you have a question?
What will be the skill set of the success coaches, and how will the applicants or candidates access this person? Will it be in person, or will they have virtual access to these individuals?
Sure. So I can answer the second one first because that's easier. They will have virtual access. So it does not have to be a face-to-face meeting. I'm sure that can be arranged if that's what you need, but it's not required. So you don't have to be able to come into a DHS office to access the service. It can be by phone. It can be by telephone or teleconference, Zoom, if you will. We are still trying to sort of set out what we think the minimum qualifications need to be. We're mirroring kind of what they do in the SNAP and T work programs, as far as like how we want this case management to work. But we do know we need some people with more robust skill sets than our DCO eligibility specialists currently have. Not that they could not learn them, but that they're not currently trained to do this type of thing. So we're setting all of that out now. But one of the things they will definitely need to do is connect this individual to the needed resources in their community. So that's, like Nell said, one of the main things we're focusing on is making sure they have access to what those resources are and can make those connections.
Okay, Nathan has a question.
Okay, two things. Building off what Jerry said about the LinkedIn, my region has something very similar, and it may be what he was talking about, but there's a library in my area that offers, I guess you would call it, labs for certain things like robotics, programming, state-of-the-art aviation. These are all things that people can use to gain those skills, like Jerry was talking about. But my question was about the life coaches, and I apologize if I missed it. You may have mentioned it earlier, but where do these people come from, and what are their qualifications?
Sure. She just asked the qualifications question, and that is something we are still trying to set out sort of the minimum qualifications for. They will be housed within our Division of County Operations. So Mary Franklin, who was up here earlier, we're pretty sure of that. So they'll need access to our eligibility system. They'll need to be able to have that training level as well. We're not sure if they're going to be state employees or contracted yet. There's still some details there we have to work out. We know we need about 100 of them across the state. And you get assigned to them. So I think you asked me that too. You get assigned to your success coach, and then it's that success coach's responsibility to reach out to you. The idea here is not to put a lot of reporting or requirements on the member, but to really try to meet them where they're at.
How does the signing process work? Is that just by region or?
Yes. We want to do it, I think, regionally as much as possible, just because you do have to have sort of these resources you're talking about. Like, you know what's at your local library. I don't know what's at your local library. So we do kind of want to try to regionalize it as much as possible.
Okay, any other questions around the room? Yep. All right, Michelle has a question, and then we're going to flip the agenda, the last two items. We're going to do the Q&A first, kind of the open discussion, because we're going to lose a lot of our DHS institutional knowledge to something, an event at the Capitol. So, but we will have the next presentation last.
So the Our Home program is, what age does it start again?
19.
19. So I have a question for kids with disabilities.
Mm-hmm.
Some kids with disabilities can go to school till age 21. Mm-hmm. A lot of them, mm-hmm. if they are, if the parent doesn't get guardianship, and they're able to make that decision, a lot of them make the decision to leave school. Is there any way or any type of, it starts at 19, but for those kids that have disabilities who are choosing to leave school and maybe they need help with this kind of stuff because the parent does not have guardianship to choose that, is there a way to make this information available to them and have that coach help those students before they leave high school, maybe without a plan, without support, without the things that they need to have a successful life? Because this, to me, sounds like that is a core group that could be getting, that this would benefit. Mm-hmm. So before they go out in the world, and I know my child, I have 3 kids with disabilities, but I know one of my children I'm helping get their GED and stuff like that, and I'm going to help her get a job and help her do her insurance. Mm-hmm. I have to help her do all that stuff. But there's a lot of kids out there that they don't have that kind of help. Mm-hmm. They are just kind of out there flapping in the wind, and they don't know about these things. So is that a demographic that this could absorb in and help? Oh.
So that is an excellent question. This program, I'm going to grab that for you. You're welcome. It's a thing I would do and probably will later, actually. This program is not designed for that demographic. This program is designed for the 19 to 64 age range that is not in our medically frail, not being served through one of our special, what Amy called specialty programs, one of the specialized populations, the developmental disability or behavioral health services. So this is not designed for that. I see your point. And I think we want to be able to pilot this and see how it is going, and maybe we can look at expanding it from that point on. It may be something we can. And Melissa's going to come up because she has the developmental disabilities.
Just can't help myself. So we are actually, although that's not a program under the PASS model right this second, we've had 3 different providers approach us to write proposals for a vocational training program for PASS members, where the outcome would be they would have to connect them with a job. Now, whether that be out in the community, integrated minimum wage supported employment, or whether that be in a workshop type environment, we know it's not a one-size-fits-all. But we're trying to get those proposals in line, and we are going to ask the PASSes to pay for that service and pilot that. Because, yeah, that's something I think we're definitely missing. And we're hearing that. We heard that during the legislative session. There's not a lot of information being disseminated to high schools
And what we were trying to explain, because they wanted us to get more engaged in that, but what we were trying to explain is like, we know Medicaid, right? We don't know everything else. Like, I don't know anything about Department of Ed and like what they offer, and just trying to figure out how to kind of bridge that gap. Because the school counselors, I think, are struggling on what the opportunities are for people, so then they're not telling families, and it's just kind of word of mouth, right? Like a lot of things are. So trying to set up a program that fills that to some extent. That's what we're looking at.
Now, I think the website that we're talking about here could potentially be made available to anyone that wants to access it, so you would have those opportunities that we're listing on there.
Because that's what I'm running into, because I have kids in 3 different age ranges, and so I'm having to be the one to help my child work on their GED, find a job, see if they're even going to be able to work, and then I'm going to have to help them do their insurance and all those things, and it's like there's just a big gap with, and I work for the Center for Exceptional Families, and we go to some of these what they call transition IEPs that the schools are supposed to have in place by the time they're 16 with a plan for the future, and they don't really know this stuff, and they don't know what organizations to reach out to, and so that's a big push in our organization, is to bridge that gap, because we get a lot of calls from families that my child's 20 years old and they, I don't know what to do, and they're, the school just, they graduated and was like, bye, see you later, and what work programs are out there, how do I help them survive and function without me, kind of a thing. And so we're seeing it's like a chasm in between. It's like once you're done with school, everybody's just thinks that you're supposed to function on your own as an adult.
So I'm going to throw her under the bus. But a lady came and spoke, and I listened to her. She was from the Department of Education. Her name is Tina Moore, and I found her on LinkedIn. Delightful LinkedIn. She talked a lot about kind of what they want to focus on as far as training students in high schools, not to go to college, but to go and learn job skills. That we need people that can do computer science, that we need people that can do technical and trade jobs, and that we're losing that we really don't need people with 4-year degrees anymore. We have those. And way too many people only have high school diplomas. So one of the areas they're focusing on is how to fill that gap of, we need these people that are skilled, that have training, but don't have a 4-year degree. So I would see if you can find her on LinkedIn, Tina Moore. It was a very good talk, and she might be able to give you some resources.
All right, last question comes from Amanda Sanders, who's watching at home on Zoom, one of our council members. Let's say there's a disagreement between the life coach and the beneficiary. Is there an appeals process, or has that not been worked out yet?
So you will get an appeal if you are removed from the QHP and put back into fee-for-service Medicaid. You do have an opportunity to appeal that decision. If you have a disagreement with your life coach, there would be
it was about that decision.
Yeah.
If they want to stay in their QHP, but they got
yes,
moved.
that is appealable.
Okay.
And you would get a notice and get the 30-day appeal.
All right, so we're going to do our open discussion part. So we've discussed a lot of things today, but the open discussion doesn't have to pertain to any of that. Maybe you've got an issue that's come up in your community, in your home, that you want to ask our collective intellect about. There is a legislative contract review going on at the Capitol that a lot of our DHS folks have to go to, because their contracts are under review and the lawmakers want them there to answer their questions. So, but for now, they're here for your questions. So if anybody has a question on any topic, we're going to entertain those right now. So just put up your hand if Jerry's got one.
The Arkansas legislature recently passed legislation, and I guess it was approved by the governor, to allow people as young as 14 to work.
That's not us. We watched that. We watched that.
Okay.
It's working without a certificate from the federal government. It wasn't changing the age of when people can work. We got rid of a federal form. But that is not us.
Right, but if somebody is on AR Kids and they get a job and they're 14 years old, and all of a sudden they're no longer in the FPL, do they lose their benefits?
Yeah, I mean, that's really a poverty level for the eligibility category they're in. Each category has an eligibility limit.
Yeah, regardless of age, they still have to meet the eligibility.
Yeah. And that's determined by those categories are determined by their household. And Mary is really the expert on this and give you a lot more information than any of us here can. But that's determined by household. So your parents' income does go into that. But there's our kids A and there's our kids B. Our kids B is up to 250, I think, 200 and something. You do have some $10 copays when you go to the doctor with that one, but it's still coverage through Medicaid. And so even if you increased your income for whatever reason, say your dad got a raise, you would still potentially qualify for that. So just, again, Mary is better at answering this. You might want to put that in an email to us so we can get you all the details you want. She would know specifics, but that's how the categories work. So just because you're not, yeah. Right. But just because you're not eligible in whatever category you were eligible in before doesn't mean you're not still eligible. We would run it against all those categories like she was saying before.
Okay. I'm going to put on my prophet hat and say that because of changes in AI, we're going to see a lot of transitions that are going to quickly happen, where people's incomes are going to change dramatically, especially among young people. And maybe some young people between the ages of 14 and 30 who may be poor one day, making six-figure salaries the next. Are you guys prepared to handle that?
They're making six-figure salaries. That's great.
Yeah, that is great. That's great news. I don't know that we can answer that today. I can barely get my computer to work, much less figure out AI. So I don't know that I'm the one that needs to be answering that question.
Any other Medicaid-related questions, Michelle?
So I do have a question, and I guess it's kind of related to some of this and kind of not. For these, the coaches that help people get the jobs and everything and help them volunteer and things like that, what kind of oversight is going to be? Because the only thing I worry about with some of these programs is, especially for people who are vulnerable, like people with disabilities, being put with work providers or with volunteer thing and their labor being exploited. So is, if they, like, is this going to go, like, if they get a life coach and they help them find a job, is it going to be like they're going to help them find whatever's available and they're not going to be put in some kind of work program thing where they're going to be paid $2 an hour?
Like a sheltered workshop.
Yes.
So this program that these slides are about is not targeting the disabled population. In fact, if you're medically frail, meaning you qualify, so if you're in Melissa's program, you really aren't in our home at all. We typically don't see people that meet the waiver requirements going into our home because they meet the waiver, and that's where they need to get services. And this is really designed for people that weren't getting Medicaid coverage before, adults who were not getting Medicaid coverage before, because prior to 2013, when this went into place, it was at 17% of poverty and you had to have a child. So, I mean, that's a couple of $1,000s a year. So it was very, very poor if you were an adult with children to be able to qualify for Medicaid. So that was the gap that this program was designed to fill. So that's the people that we're talking about here. And if you are medically frail, we're not applying this to you. If you're getting services through PASS, even if you're in our home, we're not applying this to you. So you would go over there.
Yes, I'm on AR Choices, and I've been getting this call because I'm a council member from people that know I'm on this Client Voice Council. People are concerned with the end of the public health emergency. And the redoing of the waiver and having to get your redetermination that you get every year or whatever. Is there going to be any criteria for getting any hours above the budget caps?
Anybody here that can answer that question? Yeah, Jay left.
Bradley, I'll email that to Jay Hill and get that answered for you.
Yeah, sorry, Jay left, and he's the one that knows about those hour caps.
Yeah, some of the questions you have may have to be responded via email because we have lost some people already over to the event at the Capitol. I do have a question from Amanda, who's watching online. My son's APRN with a psych specialty has been with Empower for 3 years. All claims have been paid. She recently was told she has been in and out of network for 3 years and needs to repay those payments. What can be done in this situation?
She'll have her call us. You have my phone number.
Yeah.
Jason. She needs to call provider enrollment. Typically, that's probably what that is. So
Okay.
she'll call us.
All right. Any other questions in the open discussion period? Reba?
I don't know if you guys have considered it or not, but some of your success coaches, you might want to pull, not necessarily people from college, but people that have life experience.
You know, we have thought about that, and you know, maybe one of the job opportunities here is that you become a success coach. You know, that is something we've talked about. So I agree. We agree. Kind of a peer type role.
I think we've also talked internally, just batting it around, making news to you.
I don't know what they've talked about internally, guys. Hold on. Hold on.
She's telling me to get the microphone.
I don't know what you're about to say.
Well, we've talked about having, there are some things like housing, you know, if somebody's having a housing insecurity issue, that's maybe a more difficult issue than, you know, go to the food bank and grab some food. So we've talked about maybe having some of those success coaches have specializations. Excuse me. It's not that Tic Tac. I'm sorry.
Melissa's killing people with TikTok.
One Tic Tac at a time.
So, you know, we are thinking about, I mean, we've got a long ways to go in terms of what these success coaches will look like, but I you know, we're trying to figure out what's the best mix to actually provide meaningful help.
So if you can't tell, we're still taking ideas on what a success coach needs to be. Please submit those comments to us, because I think that is something that we are talking about a lot, and we want it to be useful and successful. We want the success coach to be successful. And what does that mean? So if you were utilizing this service, if I was utilizing this service, what would be beneficial? And you may be able to help us with that. So please send in your ideas.
All right, Yolanda has a question, then I'll come down to Betty.
Yeah, we do need to go.
We'll wrap up the open discussion period.
Okay. My question kind of goes back to when I was explaining to her how I found out that we didn't have services anymore. So my question is still more about communications within departments and stuff. So when I found out that we didn't have coverage anymore for Social Security, I mean, it was a mess. But went down to the Social Security office because they told me that, oh, yes, you don't have it anymore, and you're going to have to bring the person who's actually receiving it with you. So that meant that I needed to pull my son from school, and we went. So we went, took all this paperwork with me, guy filled it out, you know, sat in the line, and perfect. He was nice. We still went through some things, but I gave him all that I thought that I was supposed to give him, and he told me he had everything. And then he said that, you know, all that his services will start immediately, but then the money that my son was to receive, he would start getting it within 3 to 7 days or 3 to 5 days. So I waited till after that, and because we didn't get anything, and I called and talked to another young lady who said, no, we're sorry, the person that you had was new and he did everything wrong. So I was like, oh my goodness. And she said, well, hold on, we're going to try to check and see what happened, but I'm at work, you know, because most of the time I'm at work. And and so she couldn't give me an answer in time. She said, is there a good time I can call you back? I gave her that time. Never happened. So I called back later on that afternoon and talked with someone else. And so the someone else said, oh, I'm sorry. It takes 24 hours for the system to upload everything. So if I try to help you now, it will boot out everything that anybody before you would have said. So you have to call back tomorrow. And I was like, okay.
Wasn't that Social Security?
It was.
So
Okay, oh my God.
yes,
So-
yes.
We have our own problems.
Yes, no, it wasn't.
I can't borrow
it wasn't
theirs.
You, it wasn't you. But I'm gonna try to connect it. But anyway, it took like 6 people to finally get what I needed, and as far as communications. So now I'm gonna switch it to. Had a conversation with one of my friends who said she just started, I guess, with Medicaid. She works from home though, and so
Does she work for me or Mary?
I don't know who she works for, but she said
She works for me. She better have said
Medicaid,
really nice things. No, I'm just kidding.
She's like if people have questions or something, or
Yeah.
something's wrong, like, I guess customer service type
Okay.
thing. But she works from home. And she told me that, a person had an issue, and whatever number, I guess she said they give them specific numbers or something,
Mhm.
phone numbers. She told that person, hey, just call me back, you know, that, she said she got in trouble for that. And I forgot what she said her boss specifically said, but, and I told her, I said, well, why would you get in trouble for that when that's what we need? We need people
Yeah, if you-
that we can, you know, because all the numbers of all the people at the Social Security office that they gave me, they never answered the phone again. So if it would be so much easier for, like I said, for me, because I'm working all day. So any little break I get, I'm just like, okay, who do I call next to try to work out stuff for my son at home? And is there just, I guess with the communication problem, that's still like the biggest issue for me when trying to find someone to help me or help anyone else, because it's not the same person we talk to. Like, I think with our kids and stuff, they gave us like a specific person that, you know, this will be your person that you would talk to, but it doesn't run the same in other places.
Well, and eligibility has changed, so now you don't get assigned an eligibility specialist. It's everybody can work every case across the state. The idea is to expedite and make it faster. I think it does work that way until you have, if you have a problem, that person may not have worked your case. So I think that might be what's happening there. We know there are communication issues. I don't think anybody over here would say there are not. I think I'm about to have to go. But I think, and we are working on them. Bear with us as we get that worked through. I don't think you should have been told that you can't call that same person back. So if you can send me that example, that would be great. Okay. Jason can give you my email address as well. And what I would say is if you just continually have problems, you have Jason's contact information. I think you have most of our contact information. I know it's a terrible thing to say, but right now it does work. When I get emails because somebody has been sent to 20 different places, I get them in contact with Robert Williams at DCO if it's an eligibility issue, or Melissa if it's a DD issue, or Jay if it's an aging issue, and it does get taken care of. But, you know, and we need ideas because we are trying to still address that and create what we like to call one DHS, where you don't get, oh, that's not my office, let me send you over there. So, because I can send you. I can send your email to Robert and say, Robert, reach out to this person. So we're working on that. But
This is real quick. On the success coach, one of the important things would be continuity.
Yeah.
So that somebody doesn't have a success coach and 3 months later they're gone and you have to start all over again, because that happens so many times.
Yes.
In all the other services.
Yes, we will consider that,
All
because
right,
you're
the
right.
Capitol is close, but they still need time to drive there and park, so they've got to go. Thank you all for being here. And thank you for being flexible and rearranging the meeting so that we could hear from you all. Martina is going to stick around. She's divided with Sarah Schmidt. She was going to present this next, Martina Smith was going to present this next presentation with Sarah Schmidt, but Sarah's at the Capitol handling the, I don't know, who won? You won. I won. Yeah, yeah. Yeah, right. And you don't have to answer questions from lawmakers. So Martina Smith is Director of the Division of Provider Services and Quality Assurance, and she's going to inform you and entertain your questions about some changes coming to the self-direction program. So, Martina?
Hi. I have with me today Tammy Rogers, and she is the program manager, contract manager for self-direction, and she is actually leading the implementation with this new vendor. So she is the one that is in the meetings almost every day as we work through this new process with the vendor as they get ready to come on board. So self-direction, if you're not familiar with self-direction, I want to give you a little bit of an overview about the program. So this particular program, it allows individuals to remain in their home and self-direct. That's the phrase that we use, self-direct their own services. So the individual can hire the person that they want to help them. They can train them, they can even terminate them. They can direct their care. In other words, I tell the person what it is I need help with. That may be our traditional home and community-based services, either through our Choices waiver or through Independent Choices personal care. So toileting, eating, bathing, dressing, all of those types of things. the person can assist them with. And the way this works is they receive a set number of hours that they can receive care, and then the person helps them with those set number of hours and what it is that they need. And so the money for this program is deposited not with the person in like their account, but it is usually given to the vendor to help pay the individual that helps them. And we'll talk about that new vendor here in a few minutes. So the vendor is what we call a financial management system. And so they also provide counseling services. So they help individuals sign up for the program. They help the caregivers sign up for the program. And usually what we have here is the individual has one person that mainly helps them, but they can also have a backup person because like you know, it is with life. Sometimes that first person may get sick and may not be able to help for a little while. They may go on vacation. So there's also a backup worker. So what are the benefits to this program? Well, first, it's a way for people to remain in their homes, right? So that they don't have to be institutionalized, go to an assisted living or go to a nursing home or something like that. Also, flexible schedule so that the person that is helping them, they can come in the morning, they can come in the evening, they can come whenever it is that person needs them to come. They can employ someone that they trust, someone they feel comfortable with, whether that's a relative or it's the next door neighbor. And this really helps in our rural communities because when you have a big agency, and I'll just use Little Rock for example, there are agencies all over Little Rock. And so you can possibly get an agency to help you. But once we begin to get a little more rural, where the population may be 200 or 300 people or so, you really need your neighbor to help you out with some of these things, or you need a family member to help you, whether that's your granddaughter or your niece or whoever that is. And so it's really beneficial in our rural areas. And then you have the value for money, and we believe that it improves the lives of the individual. Just simply having someone that you know to assist you with your services helps improve their lives. So currently, the current vendor is Palco, and they have had this contract for a little bit over 10 years. And so what we did a request for a proposal for vendors for this next cycle. And so we have selected a new vendor, and the name of that new member is PPL. And so Tammy is, like I said, our implementation manager on this project. So I'm going to have her talk to you a little bit about the new vendor.
Hi, everybody. PPL, I'm real excited, and I'm not used to standing in front of people, so work with me here. But Public Partnerships, PPL, they have a long history. So they were founded in 1999, which is over 20 years ago. And they've been doing self-direction and community-based support services for self-direction for that long. Currently, they're serving over 81,000 clients and 87,000 providers. So I guess, in a nutshell, this is not their first rodeo. They manage over $3 billion in payroll and services. Self-direction, kind of the model itself, I do want to say, there's not going to be a tremendous amount that changes about, quote, self-direction. What will change is kind of how some of the processes work. They'll actually be more efficient, more streamlined. And so I'm optimistic about the relationship and what we're working on right now that we'll be implementing here in the near future with the new contractor. Okay, so again, I said 20 years experience, customer service. The other thing is over 200 bilingual customer service representatives. They also have a portal I want to talk about while we're on the customer service, because I found it really neat that you're able to go out into their portal. It's called My Account, and everyone will have one. And in that account, you will be able to say you need Spanish, Japanese, any language you need. There's probably 30 different languages. You click on, and all of their forms populate in that language for you. So that's really a neat benefit. Their technology, EVV, they are experts in compliance with EVV. So they also offer an on-the-go, easy-to-secure mobile app, and it is also known as Time for Care. So each client will have an application set up in their portal, and then they will also use the software, which is Time for Care. Okay. Now, this is really neat, but this was one of the things that was important that when we launched EVV, we recognized this was a little bit of a challenge. and the electronic visit verification in rural areas. So they actually have an offline mode. And so a worker can go in, log their time, even if there's poor internet connectivity. You drive down the street, it hits internet, and it uploads all your information. You can still use landline, which is the IVR system, and you can also use a landline telephone. Of course, it has to be registered, but there's several different options for this. The other thing about this, this is one of my favorite things. So, you know, when EVV came along, I think partnering with everyone involved, whether it's the self-direction contractor, the state, and the client, this part here I love because it actually shows you how well you're doing with EVV compliance and what areas you need to work on. And it also tells me what additional training we need to put out for y'all so that you can actually get better at your compliance with EVV. So everyone is engaged with the EVV process and how to improve time approvals and what your needs are basically within the application or how to function with that better. It even has within it, if you're having a struggle and you're trying to log time, you can literally hit a button, it sends you to their customer service, and you can talk to a person. So I think that's it's a really neat feature that we've not had before. And let's see, I think you've got the timelines next and what we've sent.
So, you may ask, when does all of this take effect? So the new vendor will not begin until October 1st. We have a lot of things to do between now and October 1st. So the first communication has gone out. It was sent out on April the 11th. That's the communication that you see here. This was a joint communication between us, the current vendor, and the new vendor. We all sent this out together because this is a project that we will work on together for the next few months. So we have a smooth transition because that's what we want more than anything is to have a smooth transition for the individuals that receive self-direction. I think it's very important for us to say here too, nothing changes today. And we've been trying to communicate that out. We have put it on our webpage. We have also put it on the PPL webpage. Nothing changes today. And so what we've done here is we've laid out how things will work over the next few months. So this month in May, and we actually worked on this last week, PPL is getting ready to send out their first communication. And what that communication will do is to tell you what they will be doing over the next couple of months, or to tell the individuals what is getting ready to happen. They will communicate that they are getting ready to set up one-on-one meetings so that they can meet everyone, find out what it is everyone needs. And then June and July, DHS and PPL will send out another communication explaining what it is we're getting ready to do. And I know you see we're sending out something else, and then we're sending out something else. We just want everyone to be ready. We want to send out as much communication as we can, answer all the questions that we can. We have numbers on our webpage so you can call and have any questions answered before October 1st. Because again, if we have everything and all the answers, all the questions answered before October 1st, it'll be a smoother transition for everyone. In July of 2023, participants will begin to enroll with PPL. And then in August, PALCO is going to send out a notification explaining that the transition is about to begin and what will happen between PALCO and PPL. So the last dates of service with PALCO will be August the 29th and through September 11th. And then on September 12th, PPL is going to begin to pick up. And so then you'll begin registering and using the new feature that you saw here, and you'll submit time entries to PPL. On September 20th, individuals that are working for the people in the program, they will receive their last payment. And then in October, everyone will be under PPL. Do you all have any questions?
Nathan does. I was curious, just how many in
Sure.
the room use Palco or have experience with Palco or self-direction? Bradley and
Nathan.
Gary?
Mhm.
Okay.
I actually have a couple of different questions.
Okay.
I think this is a phenomenal idea. I can't wait to see it roll out. I think it's going to do a lot of good for a lot of people. Let's see, one of my questions was, is there a cap on this program? Like, for somebody that needs or wants to use this program, say they have, you know, I don't know, 60 hours a week, but they need 80. Can they get all 80 of those hours, or does this program have a limit?
So that's gonna probably, are you on waiver?
Yes.
Okay. So that is gonna fall, under the aging, because you have to have the assessment to determine your medical need. And if you have that need, and you're in independent choices, that's gonna qualify. It's based on the assessment of your need.
Which is the way it is now.
Yes.
So there's no change.
No
in
change
that.
to that.
No change in
No
how
change.
how it's operating now.
I honestly had a couple more, but I went blank. So you can circle
Bradley
back.
will buy you some time.
Hey, I have a question about something you said, Tammy. The home phone thing, like you get Straight Talk, you can hook into your home. Like my mom and dad both use that? Because like right now they have to use 2 different cell phones to be my caregiver. Can more than one caregiver use the same phone system?
That's a good question. And because I haven't gone through their actual online, the training of that system, I can't answer that right now, but I can find out for you. I know their system is very high tech and it's very flexible, so I'm hoping so. So it's called Straight Talk?
Well, they have different ones. Straight Talk's just one of them, but they have different types of cell phone, home phone service.
So Palco allows this, you're wondering if PPL does, is that?
Rather than use a personal cell
Yeah,
phone,
yeah,
one
because-
dedicated for that.
Because they said when they started the EVV, they said each worker had to have their own phone. And I'm wondering if more than one worker can use the same device.
They could. I'll just have to find out how they set it up. And that's why, too, the support broker, then they're going to engage with you and do a lot of one-on-one, because I think everybody's needs are different, what tools they want to use, whether they don't have one. It's kind of that, teaching them what devices they can use for EVV and still be compliant and log their time.
I got a question.
Sure.
Hold on, wait, Gary.
Can you tell me what the hourly pay is gonna be through y'all instead of what Palco was doing?
So it's always going to be, it's always based, Palco doesn't set that rate. It has to be based on, it has to be at least minimum wage, okay? And sometimes if your budget allows, you can increase at any time the hourly wages that you pay the person that's providing you care. It still comes out of that ultimate bucket after you're assessed. It's that lump sum bucket that Palco gets. That money is sent to them in your behalf. And that money stays in this account. And so based on what you were authorized for, that's the actual budget. If you want to give the worker a raise, you just reach out to Palco. And it'll be the same thing with PPL. You reach out and say, I'd like to give that person a raise. Now, there are times, if your plan of care, if you go to give a raise and it reduces the hours that you are needing service, say you get, I'm just making an example, you get 40 hours a week, but it takes you down to 30. The assessment says you really need 30 hours of care. So it's kind of a fine line. You have to be careful because then you're pulling that to pay someone, but you're not getting what the plan of care prescribes for you.
Okay.
So it's a fine line.
Okay, now, Nathan, Reba, Jerry, did you have one too? Okay.
What is the difference between AR choices and independent choices?
Okay, so I'm going to say it this way because I think it helps everyone. So independent choices is the name of self-direction, okay? So you have independent choices, which is self-direction, which is you directing your care, being the employer. Then you have our choices waiver. The waiver program offers you an option to self-direct your attendant and personal care within the waiver program. Does that make sense?
Okay.
Sometimes I call it self-direction waiver so people understand they've chosen self-direction piece, but they're still a waiver client. I don't know if that helps at all.
So there's independent choices within AR choices?
Yes, you can choose to self-direct and, or you can choose an agency provider.
So what's the difference between the independent choices within AR choices and this program?
Say that one more time.
What's the difference between the independent choices within AR choices and this program?
So one is a state plan based on eligibility. So you may only be eligible for a personal care, okay, which is 14.75 hours a week in the program, or 64 a month. So you're under the state plan and you self-direct. You can also be in the waiver program and choose self-direction because you say you want your granddaughter, and your granddaughter can provide you the attendant and the personal care within that waiver plan. And sometimes you'll have, Meals on Wheels, different things like that within your plan of care, but you can still self-direct. Mhm.
Okay, so I have some younger children right now that are in waiver. Is that the same waiver that you're talking about now, or is that for children?
Are you talking about CES waiver? Yeah, I think she's talking about
And that's different.
CES waiver, and that's different from our choices waiver.
Okay, so when our children get older, do they transition from the CES to this program, or are they always in the CES?
I think you'll remain in the CES.
Okay, so what differentiates, why would one be in this program and not the other? Like, why would?
It depends on which waiver you apply for and which waiver you're selected for and the services that you need. This is geared more toward the home and community-based services. 2 different waivers.
Yeah.
2 different waivers that are kind of similar, just 2
They're
different
similar,
programs.
but they provide different services.
Okay.
Right.
This is just a question from someone that had a question. She asked, what is the difference in family waiver for assistant living and Medicaid? And I asked her to tell me more. And she said, Living Choices Assistant Living Waiver. How is that different than Medicaid?
So that's actually not us.
Okay.
That would be,
No,
that's
sorry.
a J question with aging.
But forward that to me, because we
Yes.
lost some of our DHS intellect, and I can get it to the right person. Yeah, right. All right, and Nathan, the light bulb went off.
All right.
He remembered.
It's all right. It happens to me
He
all the time.
remembered.
Not exactly. I had an additional one. I'll email the rest of them to you at the close. At the close of our meeting, I'll get your email from Jason. But does this program provide any type of formal training, so to speak? Say if I wanted, I don't know, my next door neighbor, would there still be some type of formal training, or is that completely reliant on the individual?
Let me say this to you. Because you have a budget, so you reach out to the contractor and you say, you know what, for example, I'd like my provider to learn how to be a CNA or do CPR. Those are things you can ask for to be, moved from your budget into where you can pay for them to have those skills. So you can do that.
But ultimately, I guess, day-to-day operations would rely on the individual themselves or somebody they appoint to oversee that?
Yes.
Okay. Any other questions on this topic? Okay. Ladies, thank you very much. Appreciate it.
Thank you. Oh, I don't know whose pen that is.
So as we wrap up, remember, some of you weren't here at the beginning of the meeting. Be sure to sign the forms that's in your packet for reimbursement purposes and leave that, and leave your packets as well and your name tags. There was a suggestion, and I put it in an email to you all, but I will remind you that at the next meeting, we're going to invite past representatives from past providers to join us at the meeting, to be here to answer questions. We're going to have a segment of the meeting on the passes. At least that's our plan. They still have to accept our invitation, but that's our plan. To have as many of the past provider representatives here at our next meeting as possible. Next meeting is in mid-July. I know it's summer vacation season for some folks, so let me know as soon as possible if you can't be here. And if there aren't any other questions, I wish you all safe passage home, and we appreciate you being here, and we're adjourned.